Gentleman from Texas, Mr. Green, for 5 minutes.
Thank you, Mr. Chairman, and I thank the witness for appearing. I have had hearings taking place at the same time, and my questioning in each hearing took place at the same time. So my apologies for being a bit tardy, and I may have missed some things that have been said. But I do want to speak briefly about Texas and the fact that the announcement by the governor of the state of Texas to lift the statewide COVID restrictions came at a time when the CDC director was urging governors to keep some restrictions in place to decrease the amount of virus in circulation. And I would also add that authorities in Houston found that the UK variant of COVID in Houston is in 31 of 37 wastewater treatment plants, suggesting, in their words, ongoing and uncontrolled community spread of the more contagious strain of the virus. So, Mr. Secretary, your concerns that you might have about Governor Abbott and other governors dismantling the public health measures contrary to the advice of public health experts, please.
Let me, if I may, Congressman, say the following three things. Number one, we are encouraging individuals, organizations, government officials to follow the CDC guidelines and to encourage everyone to do the same. We are advocating strongly to ensure that everyone in the United States is vaccinated for the sake of the public health. We are following the science and the data. And third, we are hopeful that state leaders will permit us to reimburse state and local organizations and community-based organizations that perform testing and quarantine individuals who've crossed the border so that we can ensure the public health of our communities and of the individuals themselves.
Thank you. Moving to another area quickly. The president has proposed a $4 billion 4-year interagency plan. I'd like to get your opinion as to just how important this plan is, because it's supposed to address underlying causes of the migration in the region.
It is very important. It is of critical importance. We are, as I mentioned earlier, we are taking short-term actions to address the situation at the border. We are taking medium-term actions, such as building lawful pathways that the laws of our country permit. And we have long-term solutions to make lasting change. And the infusion of resources in the countries of origin from which these individuals flee, the $4 billion of which the president has spoken and to which he is committed, is precisely that, to get to the root causes. Because we can talk about the pull factors, which certainly a number of us have referenced this morning, but we have to understand that the push factors are so extraordinary. Imagine loving parents willing to allow and to their young child under the age of 18 to leave home, traverse Mexico alone to reach our southern border. That speaks of the level of desperation. And we must address the root causes that lead a loving parent to do that. And that is what the $4 billion are designed to do.
Thank you, Mr. Chairman. I will yield back any remaining time that I have.
Gentleman yields back. Chair recognizes gentlelady from Tennessee,